Okay, so in this part of the video, we're going to talk about um, the politics. And there was a couple of senators that I was trying to work with when we were trying to um, talk about the statute of limitations um, for victims of child abuse. Um, I was working with a particular senator, and I'm not gonna say that I was actually like working with him every day and stuff like that. I met with him, and I only met with him once, and I created a petition online to try to get signatures from people here in Indianapolis, Indiana, to help him um, solidify um, the bill that he was trying to um, work on. And so I didn't really know much about politics. I had kind of been used for politics, but I hadn't actually been in politics. So I wasn't sure of how risky and dangerous politics really is. But I will say that I have learned. I've learned how risky it is. I've learned how risky it is. In this particular part of the video, we've been talking about safety plan versus treatment plan. And on the Republican side of the conversation, they are talking about healthcare programs and safety plans that are intrusive to a person's privacy, data, and public safety. Very intrusive. And then on the other side is the Democrats who are creating coding laws where and the coding laws are based on technology codes, numbers, and cryptid type of language, and gun law prevention is what the Democrats are working on. And in this conversation of safety plan versus treatment plan, the Community North Behavior Network and Aspire, in the way that they're using and manipulating the mental health facilities that are supposed to be helping people, politics is also um, amongst the conversation. And one of the Republican senators actually worked on a bill, um, and that would be House Bill 1118, and that's Public Law 126. And coincidentally, I haven't really spoken about this yet, and I'm gonna get more into these numbers like the 26 and the 1118 and what these codes actually mean. I'm gonna be speaking about that in the next part of the video, and as we start talking more about the boarding houses and the significance of the boarding houses, not just in correlation to the Walking on Eggshells book and the staging and the scenes and the skits and scenarios and the uh, stuff that's kind of going on there. Um, um, what we're going to talk about just the politics of it currently. And so, in this particular bill, in um the bill is about mobile integration, integrated healthcare programs and safety plans, which means, and as I spoke to you about the mental health laws and what these health providers are able to do and what they're not able to do legally, the mobile integrated healthcare programs and safety plans is a part of that conversation. And the mobile integrated healthcare programs and safety plans is basically a bill that is authorizing um, companies who are acting as though they're experienced in treating people with borderline personality disorder, mental health issues, um, and giving them legitimacy to practice treating, or should I say, uh, assisting patients or whatever. And so in this particular bill, this bill was introduced in 2021, and I believe that this bill was introduced because of the events that occurred in 2020 with these Community North Behavioral Health and Aspire and uh, um, third party companies that work amongst those mental health facilities. And so in the bill, they're talking about mobile integrated healthcare programs and safety plans, provides that an individualized mental health safety plan includes information concerning a patient's physical health. So this actually was a bill, and I'm not going to talk about the health part of the conversation. I'm going to talk about that in a different video. Um, this conversation is just about safety plan versus treatment plan and mental health. That is what this conversation is about. And it's also about how they use mental health and these psychiatrists and these mental health providers to discredit and to silence victims. Um, so basically, so when they say provides that an individualized mental health safety plan includes information concerning a patient's physical health, they're saying that essentially the CDC and the World Health Organization is not only working with the health, they're also going to be interjecting that with the mental health. And so, and I don't agree with that. I don't agree with that at all, because whenever you have, it's like big tech and big business corporations. You don't want them to own everything, because then they will be in control of everything. And if they ever were to do things that aren't right, or harm people, or to endanger people's lives, it becomes difficult to fight them and obtain your justice when they own everything, when they are in control of everything. So I don't necessarily agree with this bill, because it is dangerous for the health field to be working with the mental health field to control people's information, and doing it because they're calling it a safety plan. That is the danger of this particular conversation, or this particular bill. And coincidentally, this bill was actually introduced on January 7th, 2021. And that date is interesting because I'm not going to go into the details of this guardianship and stuff like that. But it's interesting because the code that is on the termination of the guardianship when we were getting ready to reopen this case is 107. And it just so happens that this bill was actually introduced in January 7th, 2021. Okay. And it says, provides that an emergency medical services provider agency with an approved mobile integrated healthcare program shall be operated by a city, town, or township in accordance with the rules and under the guidance of the Indiana Emergency Medical Service Commission. Now, whenever they say commission, they're not talking about a mission statement. They're talking about a commission. So they are being paid on commission. Say like if you work at a store and they say, oh, well, we're not going to pay you per hour. We're going to pay you on commission. How many people are you able to do whatever we're trying to get you to do to, and you get paid per person on commission? That is the danger of this. And then the danger also is when they're saying mobile integrated healthcare program, which means it's not at the same location, which means that they are traveling and moving locations, which means it's difficult to pinpoint who the operator is and where they're actually located. So if they were to do injustices, it would be difficult to pinpoint who did it, where were they, what location was it at. It would be difficult to find the source of where the injustices happened. And then they're also calling it operated. So as an operator, provides that upon disclosure of a patient's individualized mental health safety plan, again with the safety plan, and that's why we call this safety plan versus treatment plan. And originally, Republicans thought that I was agreeing with them. No, I'm not agreeing with them, because what they're doing is even is just as harmful as the Democrats using people's mental health, people that aren't a danger to themselves or others, and saying that they cannot own guns when their lives are at risk or they've been experiencing stalkment and harassment or threats from the public. And that is the reason why they own guns. It's not because they're going to go out and harm people. It's for their protection. So here we got the Republicans here creating safety plans that are intrusive to people's personal information and safety. And then it also says mental health safety plan, a mobile integrated healthcare program or a mental health community paramedicine program may provide certain services to help facilitate the patient's safe transition back into the community. Provides that a representative of a mobile integrated healthcare program or a representative of mental health community paramedicine program may request a patient's individualized mental health safety plan from a psychiatrist, psychiatric crisis center, psychiatric inpatient unit, or psychiatric residential treatment provider if certain conditions are met. So again, the conversation about the boarding houses being used as a residential treatment provider when they're not actually servicing or providing treatment plans, and what they're doing is more harmful than it is helpful. And then using psychiatry to silence victims of abuse, because as you remember, my child molester was actually a Republican. He wasn't actually a Democrat. He was actually a Republican. Okay. And using the crisis centers, the psychiatric inpatient units, and psychiatric residential treatment providers if certain conditions are met. This is extremely dangerous. This is extremely dangerous. This idea of healthcare programs and safety plans doesn't need to be dangerous, but the way that they are orchestrating it is dangerous. It's dangerous. And like I said, on the other side of this conversation, we got the Democrats here trying to create coding laws that they are also using at these boarding houses, and gun laws prevention with the excuse of mental health. So we got both parties using mental health as a weapon instead of actually helping the people who are asking for help.